Presentation is everything. Perception is everything. Whatever you have, you will have a problem selling it. People don't have a problem. It's something we do unconsciously. People don't have a problem buying, but they have a problem selling. Here's someone who will teach us how to present it properly. He's a brand expert and strategist, ladies and gentlemen. The Chief Branding and Communication Officer of Access Bank Nigeria. Ladies and gentlemen, Mr. Amaechi Okobi. Put your hands together for
Good afternoon. You know, as I sat and listened to the doctor, I remembered something I wrote a while ago that I think is particularly relevant today. And I'd like to read if that's okay with you. This, and it was accompanied by a photograph. This is Edith Ikelobi. Ladies and gentlemen, say hello. Edith is the gatekeeper at the Warif Center in Yaba, Lagos, where she has worked for 6 years. I had the recent and incredible pleasure of meeting her and was impressed by how seriously she takes her role. As a gatekeeper in the truest sense of the word, she's charged with determining who gains access into this safe space, and she does it well, respectfully, yet firmly. Edith is the first point of contact at WARIF, offering sympathy, empathy, and support while ensuring the protection of privacy and privacy of survivors. Her role goes beyond just managing entrance. She creates a sense of sanctuary where survivors ranging from 7 months to 64 years feel empowered to seek help and begin their journey to healing. Yes, those numbers are indeed correct. There are monsters out there who see nothing wrong with sexually assaulting an infant. And yes, a 64-year-old grandmother was recently gang raped. Monsters. If you haven't guessed or don't already know, WARIF is on a mission to raise awareness and advocate against gender-based violence. It is a safe space, and as such, a man doesn't get to just stroll in. But that's not the story. A little over 2 years ago, my sister, Ofunna Adobe, and I got together with some friends to solarize the WARIF Center. Schedules being what they are, and it's been quite challenging, we got here. Today, though, finally. I'm excited for many reasons and the benefits that WARIF will enjoy. They now have a sustainable source of energy, which reduces their reliance on traditional power grids. This means lower utility bills, lower costs, huge savings which can be allocated to other essential services and support for programs for survivors. Of course, reduced costs also means that Edith can continue to get paid a salary for doing the amazing work that she does. I say all this to say that stories matter. My name is Amaechi Okobi. I want to take you through how we can tell stories to shape narratives, change policies, and touch lives. Is there anyone here that did not envision who Atinuke is, as the great doctor spoke about her today? When we look at the medical world, it's filled with data, numbers, metrics, graphs. To some people, this means a lot, but to most people, it means nothing until their names and faces and lives attached to those metrics and graphs and numbers. They mean absolutely nothing. So through story, we get to make these numbers less complex. And that's how we're able to actually communicate and drive change. These stories create empathy. These stories create a shared sense of what can we do, how can we do it, and how soon can we do it. In some places, obviously, how much would it cost and where can I pay? When I wrote that post on WARIF, I got so many DMs. How can I support? My sister was raped, my mother has been attacked, and they came pouring in. So I called her, I was like, you know what, things are gonna start happening. This is just simple me writing one single story, but imagine everyone in here doing the same. It would be amazing. And that's what this pretty much says. Why do we share stories? Stories resonate. Stories build empathy. Stories give you a picture in your mind of who Atinuke is, of who Edith is. And you're more likely to help, to support, to care when you can see a picture or a face or talk to someone that actually is going through what they're going through. Because at the end of the day, we're first and foremost human beings. Before we're doctors or lawyers or bankers, we're human beings. And we just need something that resonates with us. And that's why stories touch us. From when we were children, the things you remember are guided by stories. I know you can remember the first story you heard that you shared. What did it do to you? What did it say to you? How did it change you? We're taking it to the next level now because now we actually want to drive real change and real impact. What is the core of your story? Every story is a journey. Who is the patient? What are they going through? There's some kind of movement happening. What does their life and their life's journey mean? Every story driven through this journey should start with the protagonist, what he or she or they or them are going through, a resolution, and the impact. If you follow this pattern and tell a story with intent, the impact will be felt in more ways than you can imagine. Why are we telling these stories? Sorry, this is my boss. So you see, when your boss calls, need I say more? As nice as my suit is, I have an oga. Anyway, forgive me. So, why are you telling these stories? You want to build empathy first and foremost. You want to humanize the people that you're dealing with. You want to educate. You want to advocate. You want to promote behavioral change. You want to mobilize support. That last part is so critical because that's why we do this. But each one of those elements absolutely counts as to the reason why we tell stories. We want to drive some kind of emotion that would lead to some kind of action and hopefully impact. Same kind of thing here. Protagonist, who's your audience? The audience is critical because you cannot talk to anybody just anyhow. You have to figure out what it is that resonates with them. Will I speak to doctors the same way I'll speak to patients? No. Will I tell a story that resonates with a child the same way it resonates with a family person? No. So you must know your audience and tailor your communication and your messaging and your story to your audience. Whatever story you're telling, you must indeed have data. Because yes, data speaks. If you cannot back up what you're saying with actual real-life data, it could end up falling flat. It just becomes an emotional pull that goes nowhere. So have your data and craft your story around those bits of data. A call to action is critical. A nice story that doesn't leave the listener feeling the need to do something is just a nice story. You've made him or her cry, you've made him or her feel good, you've made him or her say, that thing in Sokoto is terrible. But you've not said anything that will drive action. So every story you tell, ensure that you end it with, I want you to do this. After my message about Edith, my ask was that you call Warif and you give them whatever you can to make sure that Edith is still getting paid a salary. So once you humanize these people and what they do, it becomes easier. Again, when you're thinking about rape victims, the first name that comes to mind right now is who? Doctors said Atinuke like 8-9 times today. to ensure it is cemented in your heart. The day you're asked to support any kind of rape intervention initiative, I guarantee you, the first person you will see before you decide, is it 10,000 naira or 100,000 naira or $1 million, is that girl that's being raped by a father where the mother is complicit but doesn't have the power. You can see her. And that's what stories do. Who tells stories? It's clinicians, health workers, it's communicators, it's researchers, it's journalists and creators, it's patients and survivors, we'll talk to them in a minute, community leaders, NGOs, celebrities, and influencers. The story of a patient, the story of a lived experience is second to none. If you haven't walked in my shoes, you can't tell my story. You just don't. Sure, you can empathize. Sure, you can feel it. Sure, you can cry with them. But until you've walked in my shoes, you're just an actor. But when you get the people that are going through the pain, and by the way, the pain is not just the patient. The pain is the mother of the patient, the parents of the patient, the classmates of the girl who was raped. So when you think about it, it can expand beyond the sufferer of whatever it is that you're addressing. All these stories resonate, all of them. But you have to be authentic. You're not going for shock value, because you have to respect these people. For them to sit and talk to you and tell you their stories, for you to share, they've exposed vulnerabilities that as an unaffected person, you can't really relate to. So we're not talking about yellow journalism here, where you just get a fantastic, sensational story and blast it out. No, you must respect these people. You must respect these communities. You must respect the way they're feeling and tell these stories, A, with permission. Consent is absolutely key, but with the respect that it deserves. Celebrities and influencers, these people have the power. And it's not just influencers on social media or movie stars, but think about the community leader that people listen to. Do we all remember COVID and the issues we had with people getting tested and all of that? If a community leader that is respected and trusted and highly regarded tells his people or her people, I'm getting tested, I'm assuring you that all is well, that it's okay, aren't you more likely to believe that person than any massive billboard I can pay for that says get tested? So that's what those people do, and we always definitely must take them very seriously. This talks to consent. This talks to being respectful. You have to understand that these stories have meaning beyond just how can I solve this problem. These are people's lives. So consent is key, representation, cultural context, and trauma sensitivity. As we tell these stories, there really is no need re-traumatizing the person telling the story, the person seeing the story. Remember when, that still happens actually, on Facebook, people would just tag you on a post that is somebody dead somewhere, guts spilling out. There's no need for that. Yes, it will shock you, but would it drive action or just actually have you think, wait, why did you even tag me on this? So we have to be sensitive, we have to be mindful, and we have to be aware of why it is we're doing what we are doing. A strong structure strengthens impact. So you set the scene. What do you want to communicate? How do you want to tell the story? What tools do you have available to you? So you're driving that. What's the problem? Introduce a character and what's at stake. Humanize the people. Humanize the community. Humanize the entity it is that you're trying to get a reaction to their plight. What's the turning point? It would be great if every story you told has a place where things got better and things got solved and everybody is okay. But we'll talk about the fact that not every story has a happy ending. But we'll talk to that in a minute. And then the end, show transformation, lesson learned, unresolved reality. That unresolved reality is that things did not go quite well. That person died. There was I forget his name, forgive me, but when the AIDS crisis was really, really going nuts in the 80s, right when it started, Elton John befriended this kid. I think his name was John something, right? He was about 8 or 9. Fully warrior mode little kid. Adorable little boy. He died because AIDS does that. But his story still resonates. His story still generated more tests than they could imagine. It generated an awareness. It generated the use of condoms, all the different things that you do to fight and prevent AIDS. But he died. So not every story has a happy ending. But we can use each of these positive or negative stories to drive our message across respectfully. This would not be fun if there aren't examples. So the first one that came to mind was, "This is our shot." Does anybody know about this campaign? Good. During COVID, there was a lot of mistrust, a lot of misinformation. Zoe knows this very well. People just did not believe that this was not a white man's disease, a black man's disease. People said this is going to decimate Africa, all kinds of things. So clinicians got together and started this campaign, "This is our shot." And it is nurses, doctors, people telling their stories and hashtagging "This is our shot." So picture selfie videos talking about getting tested, talking about the fight you're fighting. This thing hit about millions of impressions because these people humanized the story, told their stories. That concept of telling your story is what wins this game. That was what happened here. And it drove so much impact, it built so much awareness, it got people to get tested, and believability in this vaccine and a potential mitigation to COVID-19 was built here. Shong Jog. This is a humanitarian platform in Bangladesh. Now, in Bangladesh, they face hurricanes, they face typhoons, they face some major issues that in this country we're blessed to not even face. But this happens to them at least once a month. There's major drama that they're dealing with. There aren't too many platforms where they can tell these stories. But through Shongjong, they tell their stories, they drive the narrative, and they get more and more people sharing. So through platforms that aren't really expensive, it's WhatsApp messaging, it's radio, it's some TV, it's word of mouth. They're sharing what's happening in their community, they're sharing what's happening in their neighborhoods, and it just keeps driving. And SMS. Fatima's journey. Do we all have sisters here? Does anybody have a sister? Do you love your sister? Okay. So Fatima has a sister, and her name was Fatou. Fatou they're both Somalian. Fatima was starved in drought-ridden Somalia. She's starved, she is weak, she's pretty much dying. And this story is about Fatou getting her to a health center where they could address their need and in the end save her life. The journey, the destination wasn't the story. What made this story so fascinating was Fatou's telling of the story. And what you see here is intense love, resilience, a can-do spirit that says, I will not let my sister die. These are not adult women with power and might, by the way. These are two little girls. So there are multiple heroes in this story. There's Fatima who survived, but even though it's Fatima's story, it's her sister Fatou telling the story about how they lived through this incredible, terrible journey to get to a health center. What this does is it put a human face on global malnutrition and increase empathy-driven support. Again, when you can see the faces, when you can hear the voices, incredible things do indeed happen. I'll be sharing ku. I know I didn't say it properly. Thank you. Can you tell me what it means literally?
So means guess what?
Oh, I have good news. Okay, sorry, tell the story.
Yeah, so when you want to tell somebody a story, you say addition. And then the person says that you have to give them something in return for getting the story.
You're sharing stories. You're sharing good news. My research, ChatGPT says, it's about I have something good to tell you. But like Zuera is saying, while you're telling that, I too want to hear your bit of news. So there's a sharing that goes on. I tell you something good, they're not debating who spoke Hausa better. But when you're sharing, when you're giving information, getting information, talking about what's happening in your family, your life, all the different things that happen, you start to spread the news. And again, you don't need massive platforms to do this, but you're sharing stories that are relevant to you. And a story that comes from someone you know and trust and can relate with is a whole lot more impactful and meaningful and truthful and authentic than any massive ad campaign you can run. And this platform has done very, very well, and it continues. It's a 5-minute weekly drama where they just tell these stories. Apropos doctor, I know you guys heard about him. He was here? No, call him. I want a picture. I'm about to talk about him and he's here. He can say, no, Amaechi, you're lying. Wait, call him. Oh, man. Well, okay, so you met him. This is him. And he's amazing. He's amazing in that he has used social media on such a platform that is phenomenal. But what I think is brilliant about him is the sharing of his own story. He too is going through a battle. And when a doctor can use his story to drive action, it's believable. It just is. A rape victim can tell you so much more about what it's like than, God forbid, a man. Right? So just call him. Now, you know, I had to include something about art. Art also speaks, and art speaks loudly. So there's somebody called Tonya Neji, and she's an artist. And she uses her art to tell stories. And she tells stories about pain and suffering. So there's a condition called polycystic ovary syndrome, PCOS. And there's stigma attached to this for a bunch of reasons. There's so much stigma around issues to do with women, much more than the one or two that men have. But that's a whole different conversation. But what she does is that it brings this out. Through her art, she's telling the stories, and because she does create beautiful art, and this was just one picture, but there's so much more. There's an exhibition that she did, You May Enter. She's telling the story of PCOS, of survivors, people that are fighting it, and I just thought she's beautiful. Impact when done well. Storytelling, when done well, also impacts your pockets. When you tell a good story, people are driven to action. And let's be honest, all these initiatives, whether it is WARIF, whether it is, whatever it is, they need funding. Donors are more likely to support you. Donors are more likely to invest in your initiative or your startup when they can see and feel and empathize with the story you're telling. Make them see Atinuke. Make them see Edith. Make them understand that if they don't bring their money, Edith does not get paid. If she doesn't get paid, Warif is open to all kinds of drama. So these people, the money people, these are the stories that they need to hear. And that's what all of this says. Okay. There are multiple channels for telling stories. The first one is obviously word of mouth and just sharing. But public speaking in events, much like this one, help. Social media is huge and getting much, much, much bigger. Does everyone here have a social media account? Yeah, your passion is just so incredible. Wow. Yes. So me that's standing here, how should I feel when I don't get the engagement I'm looking for? Let's try this again. Does everyone here have a social media account? Yes. Correct. You have power. You have incredible power. You could have 10 followers or you could have 1 million followers. You have an aura of influence around you that you can drive your stories through. But be consistent. Be consistent. Engage. I've been accused of posting and not asking people back, so I'm going to change. But you must engage. When they ask you a question, answer. Give me more on this story you told. Tell them. Social media is cheap. It is you. It's authentic. The power behind social media cannot be overstated. Video and film, documentaries, this is easy to tell. Written narratives, blogs, op-eds, newsletters, media, press coverage, email, websites, people, ambassadors, community leaders. We talked about this earlier. Best practice, again, know your audience. Match your content, match your platform to the audience. Subtitles and translations. Without Zoera here, I would have still been guessing how to pronounce Abishirinku, which is not quite the way to say it, but right? So whatever it is that you're trying to communicate, be mindful of your audience and make sure that they can understand what it is that you're saying or trying to pass along. Always include a link for deeper engagement or for contact even. You drop something on there and you don't tell them how to reach you or how to get more information, you haven't done the job at all. End with a call to action. There must always, if nothing else, there must always be a call to action. Do this, go here, buy this, swim here. Always. So the big takeaways. Storytelling isn't a luxury. It's not a fun thing to do. This is leadership. This is what actually, it's part of your, it should be part of your strategy. I think some of us here are in communication. Storytelling wins because empathy is what wins. Once people can see and understand and relate to you, you're halfway there. When we build stories from truth, respect, and purpose, we build movements. And what we want to do is actually build movements. Make people go in a certain direction for good. And the power is here in this room. Everybody here is a storyteller, and everyone here can see how healthcare is seen, understood, and delivered. And on that note, I thank you very, very much. Are there, you can sit down, sit down, sit down. Are there any questions? Correct.
Question, please.
I already asked them, they said no.
No? Ah.
Thank you.
Ah, okay.
Zoera has a question.
Sir.
Yes, okay.
So, thank you, Amaechi. That was really very good. My question to you is, how do we, what what would be a validation mechanism for all of us getting on social media and amplifying stories? Because I'm envisioning like a cacophony of endless messages that are not necessarily right? You know how a lot of, misinformation is spread. A lot of people just get up on a soapbox and say whatever.
Absolutely.
So how do we know who's telling the truth, who isn't, what's a vetted platform? Does this person have the credibility to speak? Because so many people are on social media saying whatever they want to say, and there's no guideline to what to say. So I'm on social media, but I don't really post for many reasons. But I follow a lot of people, and so I feel like I can tell who's, good or not. But just a few words about that, I think, because we can't all feel empowered to just jump on the internet and be saying whatever we're passionate about.
It's a great question. And AI doesn't help either. There's so much nonsense out there. But the good thing about the World Wide Web is that before you go reposting or believing, check multiple sources. Facebook now tells all kinds of lies, sadly. Threads is a complete pile of garbage. But when you see a story, verify, always do. And so, long time ago, there was a blogger that I used to follow, and everything she put up, it's very sensational. I would go to CNN, then go to BBC, then go to Arise. Have they covered this thing? Is there really an earthquake in Haiti, for example? Verify, always verify. And there are tools to check. So just do that. Call a friend, ask a friend. Now, what I thought you were going to ask about was how you even measure success. How do you know that the story you're telling is resonating? And there are ways you can also check this. Its reach, its impact, its number of followers, likes, clicks, comments. There are more technical ways to check these things, but that's how you're doing it. And that's where you start. Yes. Oh, now you have a question. Zara has opened the flood. Can I have some water, please? Zara opened the floodgates. I think mine was it. It's the second one back there.
So thanks so much, Amaechi. That was really interesting, and I like the visuals that you used.
What is your name, please?
Bukia Kinshemoyin from the Amaechi Okobi Foundation. Thank you.
So in a place like this, when you're going to ask a question, say your name so that people know who you are.
Yeah. You know who I am, but yes, people in this room don't. Okay, so my question is, so you just talked now about how do we measure the success. When you are telling the stories, how do you measure the success? So if you do measure the success, you've told the story, you've measured the success, and you're finding it's not making an impact, what can you do to go back and maybe tell the story differently or improve that story? It would be really good to know. Thank you.
So, thank you very much, Buki. So, when your story isn't reaching that level of success, it could be based on many things. What platforms are you using? And there's a series of platforms, right? So, like Marcoms, when you're trying to communicate, you do your audit, and you see where you're getting more traction. So you put more money there. If your internal comms isn't doing what it's supposed to be doing, find out what's going wrong, but definitely put your money where you're getting the most traction. Some stories would fly and resonate, and some won't. But I think a lot of times is the platform that you're using and the audience that you're tailoring your communication to.
More question? Anybody? Question?
When you have to beg like that, it's finished. Thank you. Yeah, I don't understand. So,
sorry about that.
Are you really?
Yes, I am. Good afternoon, everyone. I am Amaechi Okobi. I am currently a youth corper serving at NAFDAC. So I wanted to just ask about storytelling. What or where would you advise that we, get to learn more about these things in depth? Because we all know storytelling is all about empathy and, resonating with people and all. And it's a very beautiful way to get what you want, whether genuinely or not genuinely. You need to tell good stories. So how can one become a professional storyteller? How can I, or how can we learn how to be professionals in storytelling?
Great question, and thank you. So there are courses you can take, for certain, right? This thing called the internet is amazing. I promise you, if you did a ChatGPT search right now, where can I learn how to tell stories with impact or that create impact? It'll give you a slew of names, right? Now, of course, it will hit you first to Columbia, Harvard, Yale, blah, blah, blah. And then now, tweak your prompt to Lagos, Nigeria, and it'll give you more. And then tweak it further. My budget is ABC. It'll give you more. Because you've asked, I will go do some of that research for you and have some names for you. But let's not underestimate the power of the internet. Every question you've asked me in here today can be answered through Google, through ChatGPT, GPT, Gamma. It's all out there. Me just answering them here just because I want to try this suit on. But you can definitely go dig and get this information. But that one, because you asked, and because you're a youth copper, I will find some research for you. We'll talk about it. And don't just say, I want to go and learn it, and then just, you must actually go and take the courses. You get.
All right. So we have one more question, but before then.
Shall I sit down?
So, no, not yet, sir. We have one more question. So he said we will talk about it. What it means is that don't leave you until you get his contact, right? Okay, great.
My contact is right there. I'm on LinkedIn, Instagram, Twitter. I'm on all of that. DM me and I might respond. We'll talk here. We'll talk here.
One more question.
Yes, please.
Good afternoon, sir. Thank
Good
you very
afternoon.
much. My name is Ishola Tai Josephine.
Hi, Ishola.
Yes. Nice to meet you. I'm from Mountaintop University. I'm a PhD student, and I'm looking for funding for my bench work, my upcoming bench work. So I spoke with Apoko Doctor, and he advised that it's not about the funding, it's about the resources. So based on what you've told us, what do you like? My question really is, how do I employ storytelling to influence resources, especially like maybe through the government or like organizations? Because one thing that is very important in research is funding.
Critical. That's the multi-million-dollar question you just asked. Funding is what drives everything. But before I even talk to that, that you're going for a PhD is incredibly admirable, and I salute you. But this fundraising thing, it's not so easy, because you have investors that are looking for a way to put their money. You have investors that don't want to give certain initiatives for whatever reason. So it's about places like this, meeting people, networking, sharing stories about what inspired you. What's your PhD going to be in? I'm sorry, say that again.
Molecular genetics and biotechnology.
So you're pretty dull in school.
Okay, my research interest is drug discovery and drug design. I'm working on chikungunya virus and dengue virus viruses. They are arboviruses that are endemic in Nigeria, in West Africa. And they are febrile illnesses that are mistaken for malaria. And the prevalence is not necessarily known because the data is very low. So I'm working on detection of these viruses in certain locations in Nigeria. Thank you very much.
I promise you, I'm not intimidated. I am not afraid of you. But wow. This is in no way supposed to sound patronizing, but the fact that you are a woman, a young woman, doing what you're doing, it's huge. So I don't know how I can support, I don't know how I can help, but I have somebody here who has access to a ton of money. I will speak to her and I will see what she can do to help, and I will see, because you should be supported and celebrated and acknowledged. You are incredibly intelligent, and that's terrifying.
Any more question? Anybody?
DM me.
All right.